Are you starting the new year with the same chronic neck or back pain? If you've tried a variety of options and the pain has been either constant or maybe has even gotten worse, our expert in back and neck pain can help you. Dr. Christopher Miller with Total Health Chiropractic joins us now with some of the ways you can help alleviate chronic pain. Welcome to 8 West.
Happy New Year, Terry.
Happy New Year, exactly. Yeah. So I was asking you about, the fact that we're still going through this coronavirus pandemic. A lot of people probably are just suffering at home because they don't realize the options that are available to them.
And it's tough for them. With New Year's here, a lot of people have New Year's resolutions and goals. A lot of it commonly is get in shape and exercise. But, these people are struggling with back or neck pain or pinched nerves. Really don't see that as an option. They're just in too much pain. And what I want to start with is that we all encounter physical stresses, chemical stresses, and emotional stresses in our lives. And that's not going to go anywhere. But when we don't take steps to maintain a healthy spine through good nutrition, specific spinal hygiene exercises, and regular chiropractic care, the spine actually rots and degenerates or decays, and that one of the most common conditions people struggle with is a bulging or a herniated disc.
Yeah, it's interesting you brought the spine here just to show us exactly how interconnected and really how important it is because
Absolutely.
of so many of those nerves that are contained there.
So all of our nerves stem from our brain and spinal cord that go out to our bodies, and the intervertebral discs are all these pads and spacers between each vertebrae, and when they're healthy they're kind of like a moist sponge, but when it leads to a bulging or herniated disc, we had a couple images here. These discs can actually, on this image, the blue part at the top is the disc, and then the red and yellow is the spinal cord and the nerve roots. But these discs can actually start to push out or tear and herniate out, pushing into the spinal cord or nerves. And it's a very painful condition to these patients, and many times it's not only the neck or back that hurts, but it can go where these nerves travel, where it can affect the extremities, like down the arm or into the hand, or down the leg, through the buttock or the hips, or behind the knees, or even into the feet or toes. And it's very limiting. Sometimes it's shooting electrical pain, other times it's numbness and tingling. They don't a lot of times feel like they can feel their leg, and it's almost like a stump where it's tough to walk, and they have concerns of falling. Other times they may be dropping things they can't grip, and they don't have that strength. And these conditions all stem from a pinched nerve, and again, many times it's due to a bulging or herniated disc.
And it's interesting because you get pain and people think, well, I have to get rid of the pain, and so they try some remedies which actually either mask the pain or maybe set the stage for making things even worse.
Yeah, the common treatments that are recommended, many times they may start with physical therapy, and sometimes that's even recommended before they even know what the actual cause of that pain is. But then it's usually drugs, shots, or surgery, and most of the time these treatments, like you said, just temporarily mask the pain. They're not actually fixing the cause of that pain, and they all have side effects. Some of them can be as bad as death or paralysis, sometimes affecting blood sugar levels and diabetes or osteoporosis. And when you don't fix the problem, you just mask it, it's almost like a cavity in your tooth where the condition continues to get worse, and to a point it's so far gone that then those treatments don't provide any relief at all.
Yeah, so let's talk about the option that you have, the DRX 9000. It's a specialized piece of equipment that you really have pioneered.
I've been doing DRX 9000 therapy with our patients now going on 15 years, Terry. And this is a non-invasive medical device. So there's no drugs, no shots, no surgery, no electrical impulses into the spine. But it gently, through the aid of computers, treats that specific area of the damaged disc and nerve irritation, and it actually regenerates those discs. So when they are bulging or herniated, it draws that herniation back into the disc area where it should be, and sometimes they have degenerated discs as well, where it can draw the moisture and nutrients back into the discs. So our patients really are able to, by fixing that disc problem, getting their discs healthier, then they're able to go live a normal life once again and not have to continue on with the drugs or shots.
Yeah, I love this animation because it really does a great job in exactly showing you how this machine works and why it is so effective at treating this condition.
And it's very different. A lot of people talk about inversion tables, just hanging upside down and stretching. This has a logarithmic curve that interacts with the patient. It has a servo motor that works in multiple directions, and it works with a patient into a state of relaxation, so that their patient's body isn't fighting against it. It's actually able to relax and change that disc, and it's safe and relaxing for the patient.
Yeah, and if a patient starts to really tense up, then the machine backs off, which is interesting because it's just so sensitive that way. So I was able to interview a young woman who was able to get great relief. Tell us about Amanda. She's so young to have this kind of serious back problem.
Yeah, Amanda had a nasty injury. I believe it was for volleyball tryouts, and this is a young teenager, young woman that suffered an injury and developed a couple of herniated discs in her lower back. And many times when they're that young, they try the drugs or the shots or physical therapy, and they don't really want to do surgeries because they know it creates other problems down the road when they're that young especially. And she just was at the end of her rope and kind of gave up on therapies until she found us, and we were happy to help her.
Yeah, let's take a listen to Amanda.
Things started to progress, and I had shooting down my whole right leg into my foot. And I was really favoring my left foot, and I could tell something was off. So I finally got in with my regular doctor, and she said, well, Amanda, you have a herniated and bulged disc. Having back pain like that just really limits the things you used to enjoy. I had one last hope, and I was like, Mom, let's check out this place, and brought us here, and it's been great ever since. We started out with my L5 and then transferred to my L4, and you do 10 weeks total, 5 weeks on the decompression. And I started noticing change like right away. Like my first one, I was a little sore, and then after that, made great progress. He was very detailed, so we pulled my MRI from 5 years ago, and he just kind of explained, and then also pulled my most recent x-ray and said, like, this is really bad, it's getting worse. Just to see that, like, your L5 disc is supposed to be the biggest, and it was the smallest, and how over 5 years it had even gotten worse. And so he's very detailed, explaining how the process goes, what you can see, even the process of, like, you could go through surgery, but the main thing that really stuck out was, like, you can get a surgery and that's going to fix, like, the pain, but you're not fixing the problem. That was, like, the biggest thing for me and my mom was that's what we want, is to fix the problem, not the pain.
Wow, just incredible.
Yeah, and so this MRI shows her herniated discs, and I just want to mention to the viewers, we have a very safe office. I know COVID is a concern for many of them, but our team has to check in when they start their shift. And unlike a lot of chiropractic offices, we have individual treatment rooms. It's a long hallway filled with individual treatment rooms, so we don't have patients, gathering together. They're in their own individual space, and everything's sanitized and cleaned after each patient interaction.
Yeah, so don't suffer in pain any longer. We know that you're able to treat all of these options, and you do have a special for 8 West viewers.
Yeah, for New Year's, we want to offer for $20.21. If they call our office and schedule, we'll do a consultation where we'll meet one-on-one and discuss what's going on, and then a thorough physical examination to get to the root of their problem and try to determine if they are a candidate for DRX therapy. And a special bonus for the first 3 callers, they'll also be able to get a free hydrotherapy massage, start the new year right, and get on the right track.
That sounds great. Well, thanks so much for stopping by 8 West, and Happy New Year, Dr. Miller.
Happy New Year.